Yo, everybody, what's going on? Dr. Dylan DeLorenzo, Applied Kinesiology Center of New Jersey. Welcome to our first edition of Muscle of the Week, where I'm going to start discussing every single muscle in the human body, what it does, what nutrient it's attached to, and if it's in dysfunction, what kind of pain you should be having. I'm going to be posting this once a week for the next 35 years. And that's a long time, 35 years. So the first muscle I want to talk about is the quadricep muscle. The quadricep muscle is the muscle we use to squat. The quadricep muscle attaches right below the knee and right here in the hip. When there's dysfunction of the quadricep muscle, you can exhibit pain across the front of your knee. You can exhibit pain on the opposite side behind your low back. You can squat or climb up steps and feel pain right at the bottom of your kneecap. Soccer players, about 8, 9, 10, 11, 12-year-old that have pain over here, that's a quadricep deficiency. That's an inhibition of the quadricep muscle. The quadricep muscle, muscle is either fire or turn off. So when I'm talking about it doesn't work, it's turned off. It doesn't mean it's weak and it needs to be strengthened. It means it's turned off. So when this muscle is turned off, think of it as the plug to it is unplugged, or how everybody knows this understanding of a pinched nerve. Think about the nerve that controls this is pinched. This muscle will exhibit pain in the hip. People complain of tight hips. This muscle is also associated with the small intestine. So people that have pain over here, people that have pain over here, that might think it's their kidney. We can find out if your quadricep muscle being defective is hurting those two areas. That's called neurolymphatic. If you have a small intestine deficiency, which the quadricep is associated with, during an embryonic stage of life, your small intestine grows from your quadricep muscle when you're about the size of a millionth of a millimeter. Think about that for a second. They actually grow from each other. Your occiput grows from your tongue. Pretty cool stuff. This is embryology. This is when you're so small we can't even see you. Small intestine issues like small intestine bacterial overgrowth, or a hydrochloric acid deficiency, or a probiotic deficiency, or a B vitamin deficiency. Here's the most biggest deficiency I see every year, a vitamin D deficiency. So when I see a quadricep muscle that's off, if I see knee pain, if I see opposite back hip pain, people climbing up the stairs and their knee hurts, or they're doing squats and their knee hurts, or doing leg extensions and their knee hurts, they have hip pain here, the first thing I'm doing is I'm looking at this muscle. And if it is in a state of dysfunction, I go through a couple simple checks, find out where in the body needs to be adjusted to fix it, and then we give the associated nutrient if the body tests positive for it. So that's the quadricep muscle. If you guys are having pain in your knee, pain in the opposite side of your left back, some sort of quad dysfunction like numbness, or you see one leg turn out with a squat, or it just hurts or feels like pain, call me, 201-634-8755. Google us, Applied Kinesiology Center of New Jersey. I'm located in the heart of Paramus. I am the only treating doctor, and I'm the owner of the company. The only doctor you're going to see when you come in here every single time is just me. Stay tuned for more, and thanks for tuning in this time. Muscle of the Week, Dr. Dylan DeLorenzo. Thank you.